Welcome to this year's HomeoSummit. My name is Dr. Jennifer Bahr, and I'm very pleased to be part of this summit once again. And I'm so excited to talk to you today about PANS and PANDAS. For those of you who don't know me, I am the founder of Resilience Naturopathic, a pretty large group practice that focuses on the classical homeopathic treatment and recovery for kids with PANS and PANDAS, and we focus on making PANS and PANDAS a thing of the past and homeopathy the medicine of the future. I did not come to homeopathy easily. I came to homeopathy a little bit kicking and screaming. So for those of you who might be watching who are a little bit of skeptics, you are not alone. I am among you in the skeptic realm, and it was through my own personal experience of healing that I learned the power of homeopathy. I share a little bit about my experience in lots of different places, so I'll share a little bit about with you here today too. I was likely a child who had PANS or PANDAS when I was growing up. I didn't realize it until just several years ago, because it wasn't something that was actually defined when I was little. I'm old enough that I aged out of a PANDAS diagnosis by the time it was actually defined. So instead, I got some mental health diagnoses, and I got a lot of treatments that didn't work the way that they were supposed to, or that didn't make me feel very great. And it wasn't until I was told that if I wanted to have children, that I needed to do some absolutely ridiculous conventional treatments that made me willing to give homeopathy a try. I was such a skeptic of homeopathy that when I went to naturopathic medical school, I almost quit because homeopathy was part of the required curriculum. So anyway, it was through the fortunate situation where my treatment options were horrendous in order to have a child that I was willing to give homeopathy a try. I found out that it was really, really the most powerful medicine that I've ever experienced. And so I obviously had to learn how to use it. And then through my work in trying to help people who were also struggling with mental health challenges that didn't have great options, PANS and PANDAS ended up coming to me. And through my really strong understanding of what these kiddos experience, and then having conversations with my mom and recognizing that I actually had a lot of the same symptoms and a lot of the same challenges growing up, that we realized that I likely actually had PANS. So with all of that, PANS has become the thing that I am the most focused on to try and give kiddos who struggled the way I struggled, and honestly, the way my brother struggled as well, give them an opportunity to thrive faster and earlier and more effectively than I was able to. The good news is I was able to recover because of homeopathy. So I'm here to share with you some stories and some opportunities to learn about what PANS PANDAS is and ways that PANS and PANDAS can recover from homeopathy. So let's go ahead and dive in. Here's my disclaimer. I'm going to start with this picture. This picture is just, a normal picture. 5 kids out at a restaurant, eating some food, making some silly faces, just having a really good time. This picture is so profound, and I hope that by the end of this presentation, you'll understand why this really just normal run-of-the-mill picture of kids at a restaurant, it was so meaningful to the parents who were involved. So let's start with Avery. Avery had PANDAS, Lyme, and mold. She was managed by yours truly, we'll say this right up front, that I manage a team, and I lead a team of 15 other providers. I've consulted on all of these cases that I'm going to share with you today, but I do not manage all of them. So I'm going to acknowledge the doctor who does is the primary management when that's not me. So this one is managed by yours truly. So Avery's history: mom was sick a whole lot during her pregnancy. She had a traumatic induced birth, and she required repeated suction and forceps. She had spent a lot of time in the NICU and was jaundiced and had fluid in her lung, was just a colicky baby, lots of illnesses. I mean, this kid was getting UTIs, URIs, ear infections nonstop, like every couple of months. She was on antibiotics. She ended up getting tubes in her ears, had her adenoids removed. Mom, just instinctively really wanted to get her tonsils removed too, but her doctor didn't agree to it. So just the adenoids were removed. It really started off to be more clearly PANS when she was 5, and she was getting, this recurrence of these frequent colds in spite of having the tubes and the adenoids out, and having lots of GI problems. And these colds turned into they just wouldn't go away. And she had this cough that just was stuck. And it took her seeing several different specialists to finally realize that the cough was actually a tick. And then she'd also started to develop intrusive thoughts, extreme sadness, restrictive eating, OCD behaviors, and memory regression. Her memory was so bad that mom always tells the story about the time that she had just finished feeding her breakfast, was in the middle of cleaning up dishes and everything from the breakfast, and Avery came in to say, "Mommy, when are you going to feed me breakfast?" and insisted that she hadn't eaten yet and that she needed to be fed again. This is a kiddo who was hyper reactive to lots of things. So was given antibiotics. They helped the first time, but every single time thereafter, like as soon as the antibiotics stopped, the symptoms came back. The next time she started the antibiotics, instead of having 100% improvement, it was 95% improvement. Then it was 85% improvement. Then it was 70% improvement. And you had to keep adding antibiotics to just get even less results than she got the first time around. So it just wasn't working as well. Started lots of different supplements because the medications weren't working as well. And so sensitive, like things that would typically be beneficial to people, she would have a negative reaction to. So again, lots of treatments were tried prior to homeopathy. So we'll just go through a couple here. So she was on antibiotics, several different types you can see here. She used cimetidine. She used IVIG, which is intravenous immunoglobulin. It's used for a lot of autoimmune conditions, including PANDAS, can be recommended for, and it did not go well for her. So again, a lot of things that should have helped or should have been beneficial, she had a paradoxical reaction to. Round the clock ibuprofen and Benadryl. Low-dose naltrexone is another one that made her worse. Dozens of supplements, literally like bucketfuls of she would have to take an entire suitcase with her if she wanted to travel to take all of her supplements. A really restricted diet: gluten, dairy, soy, banana, pineapple free, and low histamine, in part because of her sister, who I'll share a little bit about here in a minute. And then had tons and tons of tests. Again, she'd seen so many specialists. She'd gotten an endoscopy, an MRI, Cunningham panel, immune function test, genetic testing, oat testing, micronutrient testing, food allergy testing, and environmental allergy testing. For a 5-year-old, this is a whole lot of medical intervention. So she finally ended up coming to homeopathy, in part because one of her specialists who had diagnosed her with PANDAS and who had used a lot of these other things had reached the end of their rope. And they said, we've got nothing else that we can do. There's healing out there for your daughter, but I don't know what it is. You're going to have to search. And like I sent mom off and suggested that she connect with the community, and the community sent her to give homeopathy a try. So I took her case. She had frequent headaches. She needed an ice pack under her head to be able to sleep. She had a lot of fears that food would make her sick, specifically apples. She was frightened of eating apples. And her mother and father would go to jail. She was very worried, like even watching the speed limit and checking the speedometer to make sure that mom wasn't going even a mile over the speed limit so that she wouldn't go to jail. She had reading and drawing regression, a lot of tics. She moved her head and neck around, mostly like with her head and her chin pulled back, moved her tongue around in her mouth, kicking her leg out when she walked, and a lot of hand and finger movements. She was really, really sensitive to touch with her skin, and she had toe walking that was new onset, was very clumsy, again, new, and a lot of balance issues. As I shared, her memory was really bad, that she'd forgotten that she had already eaten something. And she was very self-critical with her memory. She had been a soccer player, and she said that she forgot to play soccer, and that she told her mom that she should just go to heaven because she couldn't play soccer anymore. Intrusive thoughts about going to jail, as I shared, separation anxiety and fear about the unknown, beliefs that friends were mean to her when they really weren't, repetitive speech, starting with just words and then transformed into full sentences. Rage. This was a sweet girl, very sweet, mild-mannered little girl who became very rageful and used a lot of ugly words, as mom said, intentional disrespect, hitting, kicking, pulling hair. And then ADHD, constant talking and interrupting, quickly changeable mood, very restless, flipping around upside down a lot. This happens a lot in PANS. People don't realize the silliness and like the specifically needing to be upside down happens a lot in PANS. As I shared before, she had a lot of GI issues, stomach aches all the time, but these waxed and waned. They weren't persistent throughout the day, didn't have a really clear causative factor. It wasn't necessarily always after eating or when she was hungry or anything like that. Good days, she would have like 12 different times that she would complain about it. Bad days, she would complain 40 different times. So it really was fluctuating with how she was doing overall as a whole person. Very large stools that smelled awful, really sensitive to fatty foods, diarrhea within 10 minutes of eating sugar, and then very sweaty, especially on her feet. So this was just an example of how I repertorized her case. So I gave her silica, 30C, for her first remedy. She aggravated with her initial dosing. She asked her mom if the PANDAS was back, in spite of the fact that she'd been on all these supplements and things had improved. She was better, but she just couldn't get off of the supplements, and she wasn't great. So she was better, but not good on the supplements. And so the aggravation made things actually come back a little bit worse. It can happen with homeopathy because with homeopathy, we're giving a very small dose, something that is similar to what the condition is causing and creating inside of an individual. And so we have what's called a primary action and a secondary action to things. The primary action is the action of the medicine on the body. The secondary action is the action of the body against the medicine. And the reason that it works with homeopathy is that we give something that's similar to what we're experiencing organically. And so our body pushes back against that medicine that can cause something very similar, thereby creating a state that is the opposite of what we are experiencing. And so sometimes we see a little bit of that primary action. With homeopathy, the minimum dose helps us to get as little of that primary action as possible while still stimulating that secondary action. For really sensitive folks, sometimes we get a little bit of that primary action. And that's what happened with Avery. So she was asking mom if PANDAS was back because she was having feeling sad all the time and using those ugly words and attacking people that she even would normally be able to hide it in front of, and she couldn't hide it from them anymore. And that was really distressing for her. So when I see people aggravate, we have them pause on the dose and then make sure that they are able to get back to where their baseline was before they took that first dose, and then improve beyond it with that, again, that secondary action, allowing the body that time to push back. And so that's what happened with Avery. We stopped the dose, she got back to baseline and then improved beyond baseline. And then, of course, her body stopped responding to the remedy and worsened, and then improved after another dose and then worsened again. Her anxiety and her intrusive thoughts, rage and tics, stomach pain, self-critical nature all came back. But the ADHD, fear about food, and memory all improved and stayed improved without those fluctuating. And so this is an important thing to note, that if you're trying to heal from PANS and PANDAS, that not all symptoms are going to improve at the same time. They're not all going to you can have some that all of them could improve, but some are going to regress and some are going to stay improved. The body's going to heal at its own pace. So when she got to this place that she was worsening and staying worse in spite of additional doses, we went ahead and increased potency for her to 200C because her case had not changed in any way that warranted a different remedy. So here's a list of the remedies that we used for her. I have noted here that the red remedies were used for treating PANS, and the green remedies have been for acute and navigating life during puberty and other things that have come on. So this is a kiddo I've been working with for many, many, many years. But for this part over here, we're dealing with PANS. I don't know if you can see my cursor, but on the ones that are in red are PANS. Everything in green is she no longer meets the diagnostic criteria for PANS. So early on in care for this kiddo, we needed a lot of changes in remedies, frequent changes, because she was a kiddo who was on the side where she would get sick a lot. Some PANS kids don't get sick at all. They just have neuropsychiatric symptoms. The kiddo here, Avery, she had a lot of illness on top of the neuropsychiatric symptoms. And I realized that as I'm going through this, I put this presentation together with the assumption that there was an understanding of what PANS and PANDAS was. And I realized that I probably should have given another slide to really describe what is happening in PANS and PANDAS. So I'm going to pause here to share with you a little bit about what PANS and PANDAS is, just for anybody who's listening that might not be aware. So PANS and PANDAS, PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, and PANS is Pediatric Acute Onset Neuropsychiatric Syndrome. So what happens is basically the immune system is misdirected. It's an autoimmune condition where the immune system, instead of attacking the infection or whatever it perceives as the infection, something that stimulates the immune system, it's not only addressing that, it's attacking the self as well. And so we see with PANS kids, we see the nervous system attacked, we see the urinary system attacked. And this is a well-known thing with strep, but we can see these things happen with PANS as well. So PANDAS is specifically strep. PANS is like a bigger umbrella. It could be from almost anything that could activate the immune system. So we're talking about Lyme, we're talking about mold, mycoplasma, any of the tick-borne illnesses, in addition to Lyme. Even allergies and environmental toxins can end up be creating a sort of situation that looks like PANS, or if you have PANS, those can cause a flare or exacerbate a flare. And so what this looks like is OCD, rage, anxiety, tics, regressions in cognition, regressions in behavior. So a kiddo who was able to read can't read anymore, can't do math anymore. A 10-year-old starts acting like a 5-year-old, changes in handwriting or drawing, as in the case with Avery. And you can see a lot of urinary complaints as well, and sleep changes can come on as well. So fear of going to sleep at night, unable to fall asleep, unable to stay asleep. Night terrors can occur with these kiddos. And then urinary changes can be frequent urination, bedwetting for people who are already fully potty trained and have been sometimes even for years. And there's also this thing we call phantom wetness, where they feel like they're still wet even though they're not, and so they need to go back and like wipe again and again, and it can be associated with OCD. With PANS, there's specifically it's the OCD or avoidant restrictive food intake disorder, which we saw Avery have some of with her fear of certain foods making her sick, and the fear specifically of apples. And so with avoidant restrictive food intake disorder, sometimes it can look a little bit like anorexia or some other eating disorder, but it's not really tied to the desire to be smaller or to change or manipulate your body. It's more about fear about what the food will do. Or so fear of choking, fear of that particular food making you sick or poisoning you or something like that. So it's really more tied to an OCD, so an intrusive thought rather than a desire to control or manipulate the body. So hopefully that helps you understand what PANS and PANDAS are. There's a lot of things that can be done to diagnose it. It's a clinical diagnosis. So if you're thinking, oh, is this something that my kiddo might be dealing with? One way to suggest that it might be PANS or PANDAS is if you've got a whole bunch of mental health diagnoses, it might be PANS or PANDAS, because it could actually be the unifying factor there, because it can look like pediatric bipolar disorder. It can look like ADHD. It can look like lots of things. And you can actually honestly have ADHD and PANS. There's a lot of overlap with PANS and autism as well. So you might see a similarity if you've got a child who's on the spectrum. There could be a PANS component as well. And there are some kids who have been fully misdiagnosed as being on the autism spectrum when they actually have PANS. And when we address the PANS, it actually resolved. So what I learned from this case with Avery, because I want to give you some examples of things of like ways that healing can happen for these kiddos. I learned that about 200C not having the best response in a lot of kids. She was the first one where it really finally clicked. It was her and a couple of other people that I was working with at the same time who had PANS and PANDAS that were just not having really robust responses to 200C, if at all. And so I don't use 200C for kiddos with PANS or PANDAS anymore. We had lots of what we call false acutes in this case, because again, she was a kiddo who had a presentation where she would get sick and then get like show signs of illness even when she was still having PANS flares early on. Some kids, just like I said earlier, only have the neuropsychiatric flare, so they'll get sick, but you don't know that they're sick. The only reason you know they're sick is because their OCD is really bad, or they're really, really anxious, or they are suddenly having a lot of anger, or they're wetting the bed, or whatever happens to be the way that they present with their flares. And so the way we manage remedies when we're dealing with false acutes versus true acute. So false acute is when we've got an acute illness that comes and actually causes a flare of the chronic state in addition to or instead of an acute presentation. And true acute is almost pauses the chronic state and then just has the acute presentation, and then we go back to the chronic state. In PANS and PANDAS, we see so many more of the false acutes, where it's really, even if you've got signs or symptoms of a cold, much like I have right now, that it would actually cause a flare of your chronic state as well. So you would see cold next to the anxiety, the OCD, the rage. And so I learned a lot more about that from this case, that we need to address the false acutes, and oftentimes it'll give us indications into what the next remedy is in the healing process. This mom also changed medications and supplements a lot on her own. And so it really can impact things. And so we worked together. And when we learned that a lot of the presentation that was changing or things weren't going the way that I expected, we worked together to slow down the change of medications and supplements so we could have one change at a time and know what was doing what. All right. So again, some case highlights here. I learned the 200C response. I learned about what I call the last hurrah. So if we go back, we see Costicum 30C. This was a really remarkable. So we had a lot of changes from silica, pulsatilla, chamomilla, lycopodium. You see it down here. Once we got to Costicum, we had really hit a place of stride with her. The truth is, I could not have gotten a Costicum though without going through all of those other remedies, because those were the most indicated remedies, and it got her to the place that she could have a more stable, more robust response. So having a lot of changes early on before you get like a long lasting remedy, I found this was relatively common with these kiddos. So Costigan was a turning point remedy for her. And then unfortunately she had a dental issue that came up that led to a really massive regression. It was to the point that it was almost like we had lost every bit of ground that we had made in her case. And I started calling this the last hurrah after I saw it probably half a dozen times and saw the same pattern occur. So what seems to happen in PANS and PANDAS cases is you're doing well. You know, with homeopathy, we're healing. We're doing 2 to 3 steps forward and 1 step back, another 2 to 3 steps forward and 1 step back. And so we're taking this progress, you know, and sometimes it's 5 or 6 steps forward and 8 or 9 steps back. And so we're following the ups and downs, but still making progress. And then we seem to fall off a cliff and we go way, 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 way back. And this typically happens a lot around dental things, in part because of the biofilm disruption and the massive release of bacteria, molds, viruses, you name it, that are all hiding together, and the biofilms that are created in our mouth. It just unleashes a whole lot into the immune system. And so the immune system says, oh, let's show what we got left here. And we get a big regression that can look really scary, feel very defeating. It certainly did in this case. I thought, oh my gosh, did I do anything if we're seeing all of this come back? How is this possible? But once we got her on the right remedy, it was actually a massive turning point. And again, I saw it in enough kids that I started calling it the last hurrah, because typically what we can get once we get the right fit for remedy, we get things moving, and things typically are basically to the point of healed after the fact. As I said earlier, small responses add up and allow for big change, like all the remedies prior to Costigan being needed to get there. Improvements in methylation and overall detox were seen in spite of no longer taking the supplements that were used to help with those things. So this is an important thing to remember, is that homeopathy works on the epigenetic level. And so it can help even when we've got SNPs that are not completely non-functional. They're just lower functioning, but we've got lots of supports and ways that we can help avoid the issues with them, and also help the things that are working work more effectively. Homeopathy works for that. And so this kiddo doesn't have to take any of her supplements she was having to take for detoxification and methylation support anymore. When I got to the point that I said that she was healed, or that she was healed from PANS, is because she was able to have known exposure to triggers like strep. She had an active strep infection, had typical immune response, no PANDAS flare, and was able to recover quickly, and had exposures to things that before the exposure itself would have caused a PANDAS flare, whether or not she actually got the infection, and no exposure either. All right, Mrs. Avery now, major wins. She's 6.5 years on homeopathy, following up just as needed. Everything about PANS is gone. She's still working on her acute needs and support through puberty. No supplements, no medications, no dietary restrictions. So major victories for her. She went from being evaluated for special ed to being in the gifted and talented program. She feels comfortable and confident in herself, especially academically. She's able to engage in the world and not be embarrassed. She's having lots of joy, has tons of friends, and is high honor roll and maintaining it. She's just a fantastic kid. All right, so let's move on, talk about Gatlin, who also has PANDAS and PANS. This one is managed by Dr. Katie Rowley on our team. So Gatlin started as a colicky baby, suspected food sensitivities from a very early age, always restless, would literally move until he passed out at night. Started getting recurrent strep at age 3. Some kids, you're not going to ever know that they have strep. The first time that they have strep will be that you'll find antibodies on testing that will show that they had strep at some point, but all that they've ever had are the neuropsychiatric symptoms. So you don't necessarily have to have a known history of strep. You can sometimes find it on labs. So at age 3, this mom got super lucky. So many pediatricians are either not familiar with PANDAS, or some just don't believe that it's actually a legitimate diagnosis. But this pediatrician knew about it and knew enough to suggest it when this kiddo was only 3. At this point, he was evaluated for ADHD as well, but he didn't meet the criteria, again, because PANDAS and ADHD can look an awful lot alike. And being so young, it's really hard to get that diagnosis, because what 3-year-old doesn't look like they have ADHD? So at age 5, had a tonsillectomy. There was a huge flare that was triggered from the tonsillectomy. This is a common recommendation for kiddos who, especially if they don't respond to IVIG. Some doctors will go to tonsillectomy first, some will go to IVIG first. Some people report that it's really an effective treatment for them, but a lot of people also report that it's not. Ultimately, the reason that tonsillectomy for many people might help in some cases because it's not harboring the strep anymore. But the reality is you're still going to be exposed to it, and the problem is not the strep itself, it's the susceptibility to having this atypical response to strep. And until we address the susceptibility, and homeopathy is the only thing that does it, we just end up on this merry-go-round of medications and supplements and medications and supplements and a new treatment and a new surgery and a new like higher level of intervention, many of which are not covered by insurance, although there are bills happening to change that in the country in various different states. All right, so increasing frequency and intensity of flares. This is another thing about PANS and PANDAS. They tend to be a sawtooth pattern where we have a flare and then we go back to doing better, and then another flare and then we go back to doing better. But each flare tends to be worse. Each new, good point or baseline is not quite as good as before. And then a lot of times kids will end up sort of like stuck in a prolonged or permanent flare, if you will. And so this is one reason that PANDAS can also get missed, is because there's a lot of developmental challenges that kids can go through that just make them look like they're having a hard time, can have symptoms that look like PANS. You can have transient tics that are truly transient and not problematic, or they can actually be a first sign and maybe the first flare of a PANDAS diagnosis that you're just not catching or realizing needs a certain treatment. So this kid had gone through, again, like much like Avery, lots and lots of testing for different viral and bacterial antibodies, allergens, and vitamin status. Before getting to homeopathy, he'd used antibiotics, several different types here, only short term. The flares continued, and then much like Avery, the antibiotics eventually stopped working. He had steroid bursts. The first one, there was a complete reversal of symptoms, but with stopping the antibiotics, the steroids, all of the symptoms came back, and the second burst of steroids had no impact at all. Lots of over-the-counter antihistamines, ibuprofen, anti-inflammatory supplements, immune supplements, gut health supplements, oil of oregano, and then tons of dietary changes for this kiddo as well. So during his intake, he had rage. He would turn red, yell, clench his fists, get violent, punching, kicking, throwing things, happening at least once a day, lasting 10 to 30 minutes, forgets what he says during a rage, which is pretty common. Emotional lability, turns red, weeps easily, wants to be hugged, held, and easily, especially when he's being reprimanded. Lots of defiance, separation anxiety, and fear of death. He had a lot of meltdowns at night about it. He lost 3 grandparents the previous year that contributed to some of those fears of death. And the separation anxiety was really hard with his dad because his dad was a firefighter, and he'd be gone for longer periods of time, and so it would be really hard for him. He had just right OCD, so there's lots of different ways that OCD can present. Just right OCD tends to be kind of one of the ways that we think about it, where things need to be perfect and lined up exactly right, or that, so basically perfection. And he would get really bossy with his younger brother about how he would do things because of his just right OCD. A lot of obsessions and fixations. Clothing sensitivity. Some kids will be really sensitive to tight clothing. Some kids are the reverse, like Gatlin, where he needed things to be tight enough. Blinking tic. So he had a frequent and hard tic. And so this is a kiddo that would have a neuropsychiatric flare with strep. It was his first sign that he was infected with strep, was that he would get this really bad blinking tic. Stomach aches, much like Avery, headaches on the top of his head. Wasn't able to describe the sensation because, again, he was just a little boy. And then difficulty sleeping. He wouldn't sleep alone and was worried about dreams or about dad being gone. A lot of anticipatory anxiety. Sensory sensitivity. It's another thing that can come on with PANS and PANDAS. Sensitivity to the environment, and sensory challenges, period. Like it can look a lot like sensory processing disorder. ADHD, digestion issues, and then chronic nasal and sinus congestion. So here is the repertorization for his case. He was given lycopodium clavatum for his first remedy, was given 30C. We saw improvements in defiance, rage, anxiety, and fears within a week. Headaches and stomach aches increased, suggesting a mild aggravation. The frequency of dosing was reduced, and they found an appropriate dosing strategy for him, and he improved globally. So what we're always looking for with homeopathy is the minimum effective dose, and that's going to be different for different people. Some people can really tolerate a daily dry dose of a remedy, and some people need to take a much less frequent, just only as needed dose, and might need to take it in water. And so we need to really find what works for the family and what the individual needs. And that could be that, finding a way to do a daily dose, but finding the dilution that's tolerable as a daily dose, or accepting that you can't do a daily dose and really learning to tune into the symptom presentation so you can dose only when needed. So here are the remedies that were used for Gatlin. I put a note here that he aggravates on remedies, and he, we again adjusted the dosing frequency, the amount and frequency used. We moved him to the millesimal scale. So there's a couple of different ways that homeopathic remedies can be produced. It's made through a process of serial dilution and succussion, as you likely have already learned about. And so there's different scales that we can use. So the dilution can be 1 to 10, that's an X scale, 1 to 100, that's the C or M scale. So M just is 1,000 C. And then there's 1 to 50,000, that's the LM or Q scale. And so some people respond better to the LM or Q scale, the millesimal scale. The cases that we've seen that tend to respond better, sometimes it's people who are really sensitive, sometimes not. Sometimes it doesn't make a big difference for them. In this case, it was a really good move because of the sensitivity. He was less likely to aggravate on the millesimal scale than the centesimal scale. And there's another situation where people will sometimes do better on the millesimal scale, and that's when they tend to respond better to lower potencies than higher potencies. Because even though it's 1 to 50,000, the way that they're prepared ends up being lower potencies in the long run than in the centesimal scale. So he was stung by wasps while he was on arsenicum album. And so you can see here, I've got it grayed out because he was doing okay, but not fantastic. But those were all necessary remedies to help him get small improvements, much like Avery had at the beginning, small improvements that were able to add up to eventually get back to a place where he was doing really well. For some reason, we have seen in the PANS community, at least in our practice with the thousands of kids that we work with, wasps are another thing that can cause really big flares, really big backslides for these kids. Not really saying the same way as like a last hurrah, but there's something about wasp and hornet stings specifically, not so much bee stings, that seem to be really sending kids into a bit of a tailspin. So it was a period of time where there was lots and lots of change that needed to happen for remedies, and it was really challenging for everybody. But none of the remedies were really making substantial improvements, but they were all making like little changes. They just weren't quite getting back to the place that we had seen before. But the good news is he did get to a place where he finally got substantially better and was able to be back to the really good place that he was, where he was getting recognized at school for how he was doing. So let me give you just some of the wins and stuff that he's at now, because the good news is even though he had that really big backslide, and it took a lot of hard work with him and his provider and even consulting with some other members of our team to get him back on track. He did get back on track. Now he's nearly 3 years using homeopathy. I think now at this point he's actually just over 3 years. Rage and OCD are gone. Separation anxiety, sleep issues, headaches, heartburn, digestion issues, and emotional lability mostly gone. I'm still working on ADHD, but it's much improved. Occasional OCD, and I think that actually since I wrote this particular slide, that even I think is improved, and the tics are almost completely gone, if present at all. Mom shared recently that she has finally reached the point that she recognizes that PANS is not what they're dealing with anymore, that the PANS has recovered. It's just some underlying ADHD that they didn't meet the criteria for before, but do meet the criteria for now. And that homeopathy is helping. We just have to shift the way that we address it, because the approaches to management of ADHD is different than the management for PANS. Still uses occasional melatonin for sleep, no medications, no dietary restrictions other than trying to limit dyes and sugars. Some major victories here: multiple behavioral awards and student of the month awards in school from a kid who couldn't sit still and was constantly getting trouble and like potentially getting kicked out of some of his schools, to being, getting student of the month, participating in sports and outdoor activities, lots and lots of friends, all A's when he had almost been failing because of his attention span. And he had strep without a flare, which is a really strong sign of what we're looking for when we're seeing kids recover from PANS and PANDAS. This is his little brother, Torben. He started when he had soft signs of PANS and some mold sensitivity. This is another case that's managed by Dr. Rowley that I've consulted on. So Torben was an IVF baby, very sick during pregnancy, planned C-section at 38 weeks, no complications. He was born at the height of his brother's PANDAS, which is part of the complicating factor, trying to figure out how much was learned behavior from his brother, how much was stuff going on with mom. He did have food sensitivities that were identified really early on: dairy, soy, and eggs. And then he was a happy and easygoing baby once those were removed. At age 2.5, defiance and tantrums started. But I thought it was just typical 2-year-old behavior, but then behavior started to seem more like compulsions, and then sleep regressed and he developed a stutter. So mom was on high alert because of the fact that his brother had PANDAS. He didn't use any medications or supplements because of the fact that his brother had success using homeopathy. So he just went straight to homeopathy, didn't do a ton of testing because the testing does not have any impact on the remedies that are selected. And PANDAS is a clinical diagnosis anyway. So even testing can help suggest, but it can't prove or verify that you absolutely have it. And then they did use occasional ibuprofen and melatonin just as like rescue things. So with his intake, he had rage. Anytime he was told no, he would throw himself on the floor, growl, and hit. His cheeks and ears would turn red. He would have 3 to 5 episodes per day, lasting 5 to 25 minutes. And the worst, it would last for several hours. He was demanding and defiant, would tell mom what to say and tell her no all the time. Sleep would take over 2 hours to actually fall asleep and still wake up multiple times a night, even with melatonin. Sometimes he'd be up and ready to party at 3 a.m. Nightmares and night sweats were a regular problem for him. Very highly sensitive to reprimands and reproaches. He would whimper when he was scared. A lot of OCD-like behaviors with persistent thoughts and demanding things a certain way. So his brother had that just right OCD, so he was a little bit, had some similar challenges with that. And then clothing sensitivity. He wanted things to fit a certain way and would get stuck if it wasn't right, but mostly he just wanted to be naked. He had stuttering speech and would repeat words at the end and add sounds in between words. Stools were constipated, and if he had eggs, it would be loose smelling stool. I should say foul smelling stool, not good smelling stool. Nosebleeds, spontaneous, but not profuse, a couple times a month. Really bad eczema, but from when he was a little baby, that was the part of the food sensitivities were discovered because of the eczema, and then teeth grinding. So here's what we repertorized for him. He was given sulfur 6C for his first follow-up. The rage shifted to sad and whiny almost immediately and then improved within the first week. The sensitivity to reproach was the same frequency but less intense and easier to redirect. Stuttering improved. Mom had caved and given him ibuprofen after the intake, and stuttering was gone for 6 hours, confirming that it was inflammation-driven. Defiance was improved, but he was starting to regress again at the first follow-ups about a month later. Sleep had improved. I was getting to sleep faster and waking less often through the night. Nightmares were gone. Stools were the same. No nosebleeds were gone. Eczema was gone, and teeth grinding was gone. So he responded really well to sulfur. Again, because he's a little brother of Gatlin, it was quickly got to the place where they tried the LM potencies or the millesimal scale, just because I believe he was having some mild aggravations. And I'm remembering that backwards. As I have noted here, he had more aggravations than his brother. This is a family that's just very, very sensitive to remedies, which can happen, that you can have that sensitivity that can tend to run in families, because it's usually when you're sensitive to remedies, there's a lot of sensitivity to other things in the world as well. And because Pans and Pandas has a greater sensitivity to things in the world, they are more likely to aggravate than the average person in the population. Still, most of them don't aggravate, but in this case, we have several aggravators that we're presenting. All right, so this was a tough case because it started early, because mom had like those early signs. And sometimes when you see early signs, you can see improvements, but it's not really fully emerged yet. And so a lot of times we'll see that the condition almost needs to progress more to be able to get the full picture of what's possible, of what the true susceptibility is. So what we'll often see in Pans and Pandas is that when we're starting with early signs, the case will progress, probably not as bad as it had before, until we can get a more broad understanding of all of the symptoms. And then we'll typically see more improvements happen, and things get into the pattern that we typically see. So in this case, started with slow and steady improvements, but then the condition progressed to more clear pans with more of the behavioral symptoms and the urinary incontinence. Nux vomica shifted for a long stretch, and it moved beyond that regression. And then we started to see a lot more acute illnesses, especially croup. Not the clearest response, was still having flares with acute illnesses, a mix of true acutes and false acutes, like I talked about before. And then after Nux vomica, that's really when we saw the sawtooth pattern of healing. So just like we see the sawtooth pattern of worsening and progression of the condition, we see like almost a reverse sawtooth, where it's 2-3 steps forward and 1 step back, another 2-3 steps forward and 1 step back, instead of a bad flare and then a back to baseline, and then another bad flare that's worse than before, and back to baseline that's not quite as good as before. We see the same sort of backwards pattern with healing. Mom offered some insights that she wanted to share here. She said that she felt like homeopathy ripped the band-aid off of things that were going to come anyway in a more controlled environment, and that shifts were bigger after the case really progressed to have more clear PANS symptoms. And she said she encourages parents to not try and figure it out if there are confusing responses. And that she said that even with the tumultuousness of it, she would definitely take the route of homeopathy again. And I will say that in the thousands of cases that we've worked with at Resilience Naturopathic, that we have seen that kids who start early, even when they just at like the soft signs, yes, there can be that pattern of progression of the condition before we get to the place that we start to see really big changes, that they typically still have an easier healing time, not necessarily faster, but generally easier than those who come on with lots of medications and lots of supplements and have tried lots of other things first. So for Torben, he has lots of wins for life now. 2 years using homeopathy, the stutter's gone, urinary symptoms gone, sleep disruption, eczema, rage, stool concerns, and teeth grinding are all gone. Still working on OCD, but again, much improved. Irritability, emotional regulation, and sensory seeking. Still occasionally uses melatonin for sleep. No medications, no dietary restrictions, including eggs, which were his biggest trigger and like biggest food sensitivity before. He can eat them every day now and is totally fine. So this is an important thing to note, that homeopathy can help with food sensitivities. And so we just have to address the way that we're susceptible to having a reaction to those specific foods. So some victories for Torben. He just is more of a normal kid with better emotional regulation, played soccer for the first time and loved it. His teachers adore him and he loves school. All right, so let's move on to Max. Max is managed by Dr. Duncan Hurd. Max was a colicky infant, had frequent childhood illnesses, lots of ear infections, flu, and strep. PANS onset for him at age 4 with an eye blinking tic, came and went many times. And like I said before, was written off by the pediatrician as a transient tic, which, to their credit, like can legitimately happen. It's just sometimes the transient tic isn't actually a transient tic. It's just a flare of a prolonged condition that you just haven't identified yet. Mom was the one who noticed that the tic would come only when sick and that it would stop with antibiotics. Just before age 7, he got strep and the blinking increased and he had brand new symptoms: anxiety, panic attacks, nausea, hair twirling, sniffing tic, fatigue. All of those symptoms resolved with antibiotics for a strep, and it was gone for a full year. Then at age 8, the family got COVID. The symptoms increased, so the doctor gave antibiotics. He got better for 7 days, but the symptoms returned while on antibiotics and just stayed. Because again, if we're not addressing the susceptibility and we're just addressing the trigger will keep coming, and it's going to not actually help with the overactive and misdirected immune response by just trying to kill the thing that is triggering it. So before starting homeopathy, he didn't do a ton of medications and supplements. Mom ended up in our Facebook group, Homeopathy for Pans and Pandas, and she learned about what people were doing, and she was in several other Pans parents and Pandas parents Facebook groups. And so she came to homeopathy much faster than a lot of other people did. So she'd really just given daily Claritin, and having done those antibiotics that were only for active or verified infections. Some PANS kids will end up on antibiotics for years at a time, for long-term antibiotics, and there's all sorts of complications that can come with that. No supplements, and then they were restricted sugar and dairy intake. For his intake, he had tics with eye blinking and sniffing. Anxiety was health and medical related. Vomiting, getting sick, fear of robbers and intruders. Anxiety was much worse at night. He had panic attacks with difficulty breathing or air hunger. Shaking, crying, feeling it in his stomach. Fear that he was going crazy. A lot of anger with impatience. He wasn't destructive and he wasn't violent. No changes in his appearance or anything like that, other than his eyes were dilated, but they were dilated all the time. Fear of being alone. Emotional sensitivity, very sensitive to anything with animals being hurt, very sensitive to sad stories and sympathetic. A lot of visual hallucinations, which is not common in Pans and Pandas, but it can happen where you can have visual or auditory hallucinations. He was seeing colors and visual jumps or things going sideways, as he described it, and a lot of light sensitivity. He had dark circles under his eyes, as you could probably see in that picture earlier. And then some manic type symptoms or erratic changes in mood, getting really hyper, talking really fast. It could last hours to a full day, and it was often mixed with anxiety. So they were happening episodically among all these other symptoms that he was experiencing. Let's see if this video will work. Mom shared this video of what the hair twirling and the tics with the blinking that he would do. All right, so here's the repertorization for his case. We started him on arsenicum 30C. At the first follow-up, so again, about a month after starting the remedy, blinking had been gone at the intake, but came back after the first dose, which and then started to improve again. Sniffing improved and the air hunger was gone. Less anxiety overall after 1 week on the remedy. This is a kiddo who is a rare case of a prolonged aggravation. And so he can actually aggravate for over a week. Most aggravations, when they happen, are for a few hours to a few days. Occasionally, we see really, really sensitive folks who aggravate for longer periods of time. And he was one of them. And so thankfully, Mom had a lot of patience and a lot of good education about what homeopathy could do, and both the challenges that can come with it and the ways to navigate those challenges and the outcomes that are possible. And so she was willing to stick it out in spite of having this prolonged aggravation. And she benefited from also seeing that there were some things that improved even with the parts of the aggravation. So not all symptoms aggravated together, but I think that helped her, seeing that there were some improvements happening. So overall improvement at the first follow-up, the tics were reduced, anxiety was much better, there were no panic attacks, and he was able to sleep alone. Anger was better, not worried about whether or not he was going crazy, and he was able to be alone more, improved focus, and the visual hallucinations were gone, which is such a big deal because those are so scary for parents and kids. And then the mania was improved. So the remedies that he used, not a whole lot. At the time that I reviewed this case, he had been almost exclusively on arsenicum album, had only recently changed to lycopodium. And he'd spent a long time, months at a time, on each of the potencies of arsenicum album. So the case highlights from Max's case is that not all cases require frequent remedy adjustments. Many do, but some cases are going to find a good fit early on and just ride it out and adjust the remedy when they stop responding, adjust the potency, and get things back on track. Symptoms will come and go, and still taking 2 to 3 steps forward and 1 step back. But if the current remedy still covers the presenting symptoms, it will continue to nudge the body to heal. And again, not all symptoms are going to improve or fully resolve at the same time. The timidity and shyness and food pickiness, both present from birth, took much longer to overcome for him. And this case is less complicated because of the fact that he had a lot fewer long-term interventions, and the condition was fully expressed at the presentation for the homeopathic intake. So the things that can complicate it or make it just a little bit trickier is if the presentation is not fully there, so we don't know the full susceptibility and what the body can actually have as a result of this susceptibility, and we don't have and if you have the complicating factors, even if it's already fully expressed, that you have a lot of medications and supplements that you've used, because your body responds to those things just like it responds to homeopathic remedies, that the medication or supplement has an action on the body and the body pushes back against it. And so we have both the organic condition and the medication condition, basically, that we're dealing with when we have lots of those things that are previously used. And so this case was a little bit more straightforward because it was fully expressed and not a whole lot that we were needing to work through, because it was mostly organic disease that we're dealing with. He was acutely sick all the time, as Mom said, but he didn't need acute remedies because they were false acutes. And so he rarely gets sick now, and he gets through them easily with no PANS flares. So for Max, he has some major life wins I would like to share. So he's 2.5 years or so into using homeopathy, 98% healed, following up only every 3 to 6 months. Tics are gone, anxiety, panic attacks, fears, air hunger, OCD is mostly gone. Sleep issues are gone, feeling like he's crazy, anger, fear of being alone, night sweats, emotional sensitivity, dark circles and eye puffiness, light sensitivity, mania, hallucinations, all of those are gone. Still working on irritability, pain sensitivity, and occasional hyperactivity or silliness, and some gut stuff. No supplements still, no medications, no dietary restrictions. Some major wins: going on vacations, especially ones with driving in the car. He had a past fear of vomiting in the car, and so they couldn't go for even like short drives without it being a problem. And now is able to go on hours-long drives. His confidence is so great now. He can look people in the eyes and respond to them. He did a talent show at school. He played piano with a friend and did a solo rap performance. School, he's doing fantastic. Only missed 1 day of school due to a mild illness where he was missing a lot of school before because he was sick all the time. Placed overall first in a spelling competition for multiple school districts and got a perfect score and on the A honor roll. And he's had a great year with baseball. This is a family that loves baseball. He's played since he was 4, but had lots of issues with gait and his coordination. He ran on his heels, had a difficult time with throwing because of his coordination issues, and was not able to really retain what he had learned. But this year he's doing great, and he hit 3 triples, and he's just so proud. Our last case here is Gwen. She has MCAS, so mast cell activation syndrome and soft signs of PANS, managed by me. So her issues began when she was a newborn, feeding difficulties. She was really reactive to mom's milk, even with allergen removal, lots of colic, rashes, flushed face. Urine and stool was so acidic that it would burn her skin. Everything got worse when solids were introduced. By age 2, she was only able to safely eat zucchini and cauliflower. Mom said every system in her body was struggling. At the doctor so frequently, at least 35 doctor visits by the age of 2, ER visits monthly, weekly IV infusions. Mom got to the point that she had like a super, super restrictive diet. Mom had to work with somebody to find a woman who would feed one goat a specific diet that her daughter wouldn't react to, and then she would get milk from that goat. And that was one of the mainstays of her diet, was this very, very restrictive diet for the goat to then make milk that she could not react to. Lots of medications that you can see here. Tried lots of different supplements, but she was so sensitive she couldn't tolerate any of them. So on mostly conventional medications. Did her intake when she was age 4. She had rancid smelling breath with flushed cheeks and ears. Often the flushing was only on one cheek. Profuse perspiration, worse on her head. Very triggered by getting overheated. Would get really agitated and roll around on the floor, flail her arms. She was destructive, would kick and hit the walls. The acrid urine that was painful and would turn her skin bright red where her urine touched it, and sometimes it would blister and peel. She had watery and explosive stool in large volume, or small, very hard pellets like goat poop, and it was like nothing in between. It was either very small and hard, or watery, explosive diarrhea. She was considered the instigator, always bothering her sister. Capricious, where she would want something until she gets it and then no longer wants it. Very grouchy on waking. And then respiratory complaints. She had a dry cough with gagging, choking, and throat clearing or wheezing. Here's a repertorization for her. We started her on chamomilla 30C, possibly aggravated, but it was a bad coughing fit. Reduced her to once weekly, but mom was scared to give it anymore. They were traveling when they started, so we weren't really sure if it was the remedy. We changed to Mercurius for her. There were no aggravations. She had improvements overall with her stool, behavior, flushing. The excoriating urine was gone, and no breathing issues, but also no known exposures. So lots and lots of remedies used for Gwen here. Soft signs were coming up with PANS, but not exploding through. She didn't aggravate at first, but started to later, because that can happen where we change the way that we respond. So we can go from being somebody who aggravates on remedies to not aggravating as we're healing. And sometimes we don't aggravate to remedies, and then we become more sensitive as our vital force gets stronger. And we can have an aggravation later. And you can have aggravations to some remedies, but not others as well. So it's just based on the individual. In this case, I highlighted the Lycopodium 30C, 1M, 10M, 50M, and CM, because she really did not want to stay on that remedy, because we were seeing small changes. They were subtle changes. Mom really wanted to move on because she was really trying to see something bigger. But during that time, this kiddo who had a port for all of her IVs that she was needing to use, was able, like, she'd gone so long without going to the emergency room, so long without needing her IV medications, that they got her port removed. So sometimes small surface changes can be indicative of bigger or deeper changes that are happening. And that happened during that process on the Lycopodium, where mom didn't feel like much was happening, but yet we were able to get the port taken out, and haven't had any issues with needing to deal with that or consider it getting put back in. And then I put belladonna here in red, because this is a place where we had to have it come to Jesus with mom and say, okay, sometimes we have to actually provoke some of the symptoms to see what's still happening. And so with her in particular, because she's so sensitive to foods and has such a restrictive diet, we had to tell mom, it's time that you start adding some of these foods in, so we can see what actually will happen with them. Because we don't know that she's getting better if you're not challenging her, and we aren't seeing the full expression of what her body is susceptible to if you're not challenging her. And so mom started adding in more foods with belladonna, and seeing some improvements, and we've actually gained a lot of foods. So with Gwen, we are 6 years now into using homeopathy. Everything from the initial visit is gone except the food sensitivities, but we are working on them. We are working on adding foods, working on some attention and focus issues, some occasional tics that will come up because the MCAS is a lot more serious. And so a lot of times we'll see like the most serious life-threatening condition will start to resolve first, and then more things will come up, which is why you can sometimes see Pans and Pandas resolves, and then we're dealing with ADHD, like we saw in Gatlin. We got a little bit of that going on with Gwen too, where we've got the MCAS is more life threatening than PANS Panda. So we've got some of the PANS that's symptoms peeking through and some ADHD. So we're probably going to see the PANS symptoms fully resolve while we're and still have the ADHD stuff that we're dealing with. But we'll work through that too. No supplements. Medications are all at a half a dose of what was previously taken, and many of these are actually being reduced further now since I last updated this slide. Dietary restrictions, she still has a lot of them, but she's reintroducing foods and you're doing really well, gaining 1 to 2 new foods per month. There's been some times where she's had foods that are like, big no-nos for her and she's not had a reaction. She just can't have them all the time. So like before, if she had even a bite of something, she would have ended up potentially in the emergency room. And now she's not in the emergency room, not even necessarily needing rescue meds, or perhaps needing to use her rescue inhaler, but that's it. So some victories: she can leave her house and go to school. She can just walk outside, which she couldn't do for the longest time. Again, her port was removed. She's athletic and she's thriving in it. No longer having constant doctor appointments and having 5 hours of IV infusions every week. When she eats food, she doesn't end up in the ER. Worst case scenario, as I said, she needs to use her inhaler, and quickly recovers from acute illness, and she's on the high honor roll, and she's just such a fantastic, amazing kid. So back to this picture. I hope that you can see now that this seemingly just, run-of-the-mill picture of a messy table and kids at a restaurant is such a big deal, because these kids were able to go to a restaurant and eat food at a restaurant and not cause a scene. Nobody paid attention to these kids. There was nothing happening that anybody would have drawn their attention to, and it's because these kids are all healing with homeopathy that makes it possible. And so we just had to throw in this picture here because there's as the people who are with me, they said that there's another PANDAS kid here too, so you need to include them. And then my daughter, who is the reason I tried homeopathy in the first place, is down there at the bottom, and so we had to include her as well. And as I said before, I likely had PANS as a kid. I probably had PANS when this picture was taken, and my little brother all the way to the right didn't have PANS yet, but he had a very clear, very sudden onset around age 8, and so I am very certain that he had PANS as well. So I just wanted to share really quickly for anybody who wants to learn more. This is a really quick overview. I could probably do an entire week's worth of educating people about homeopathy for PANS and PANDAS. So we've got a ton of education that you can connect with in our Facebook group. And so we've got a mini course all about PANS and PANDAS and homeopathy. A lot of people call it the doctor in your pocket short videos to help understand responses to remedies. Weekly mom and doc talk videos, those have actually been moved to our podcast. We do a monthly Ask Us Anything, though, where you can ask us any questions you've got about stuff in the Facebook group, and then community connection and support from families who've been where you are or who are walking the path with you. So this is only for people who either have a kiddo with PANS or PANDAS, or who strongly suspect they have PANS or PANDAS. So it is really meant to be a community of like-minded people who understand. And then other resources that you can check out if you're not a person who wants to be on Facebook, or you don't meet the criteria or qualify to join the group. We've got a YouTube channel that we've got a How to Become a Better Observer series. This is useful for anything with homeopathy, not just PANS and PANDAS. It's to really help you understand things you can be looking at and observing in your symptoms or your child's symptoms, to help report to your homeopath and make sure that you've got really good understanding of what to share and how to share it. A super short mini course on all things PANS and PANDAS and homeopathy that you can share to people who aren't on Facebook, or that you can access if you aren't on Facebook. We've got educational videos to help people navigate schools with PANS and PANDAS, Awareness Day videos with lots of stories from dozens of families. And then our podcast is on Spotify and YouTube. It's called Mom and Doc Talk Healing PANS and PANDAS. New episodes weekly, and we've got some really great guests to talk about the things that homeopathy, like some of the removing obstacles that we need to do with homeopathy, with some experts who can talk about those things. And that is the end of my presentation. I hope this was really helpful and that it helps you learn a little bit more about how you can heal with PANS and PANDAS and what that might look like.